We start with the latest on the coronavirus situation in South Korea. We take a look at South Korea's progress in tackling the virus and discuss the situation around the rest of the world. To give us the latest news, we have our COVID-19 correspondent, Kim Yeon-seung, in the studio with us. Good afternoon, Yeon-seung.
Good afternoon.
Let's begin with the COVID-19 infections figures today.
Well, I do have some good news for you today, Mok-yeon. Actually, today's figure is the lowest for a Friday that's been reported in South Korea in 14 weeks. South Korean health authorities saw 1,440 new COVID-19 cases Friday, so very close to what we saw yesterday. As for vaccinations, the latest reported rate stood at 68.2% in terms of people who are fully vaccinated. And Prime Minister Kim Boo-kyum says that South Korea will reach 70% by tomorrow at the earliest. Health authorities are giving that one last extra push for vaccinations to reach that milestone. So people who've missed their dates for their second dose, it's now possible for them to just head over to their nearest vaccination center and get the jab on the day of. They just need to check if the center has any leftover doses, and they're good to go.
Finally, we're hearing some good news. Now, Yeon-seung, what about the Living with COVID-19 scheme? How are we faring there?
Well, until now, the Living with COVID-19 scheme was rather cloaked in mystery, and the details weren't really announced. But Prime Minister Kim Boo-kyum actually earlier today gave hints on what this plan might look like. He said that they'll start by loosening up restrictions for businesses that have taken the biggest hit from COVID-19 and those that have a relatively low risk of infection. He has yet to specify what he means when he refers to those businesses, but we can infer that this plan is going to focus on small and local businesses, as well as those in the travel or cultural sectors. More details are to be announced during the public hearing next Monday, but he also says that now is not the time to rush into hasty action. Take a listen to what he said.
When we see the experiences of other countries, it's clear that this situation is a moment of crisis with hope. It's a challenging task we have to prepare meticulously. We have to carefully take it step by step as we head down this unknown path.
Well, we just heard Prime Minister Kim Boo-kyum saying experiences of other countries. What does he exactly mean by that?
Well, all over the world, some countries have already pressed ahead with their COVID-19 scheme, but unfortunately, they've been seeing surges in cases. For example, UK topped 50,000 for the first time in 3 months. The surge there was partly fueled by a newly identified variant. This new variant has spun off from Delta and is sparking concern over whether this variant is actually more transmissible and more unresponsive to the vaccines than Delta was. This variant has also been found in Israel as well, so that's sparking some new concerns. Russia and Singapore are also seeing record deaths and cases. However, COVID-19 cases worldwide have actually been on the decline for the last 7 weeks, so it's quite surprising that these countries are seeing an increase in cases. World Health Organization's Emergency Director Mike Ryan said on Thursday that this surge witnessed in so many countries may be attributed to the eased COVID-19 restrictions and increased indoor social mixing.
Yes, Yeon-seung. Well, I can imagine that the surge in cases are taking a big toll on medical frontline workers.
Yes, you're absolutely right, and I'm glad you mentioned that because according to a WHO report mentioned earlier on Thursday, they estimate that this virus could have killed 80 to 180,000 healthcare workers between January last year and May of 2021. Along with this figure, the WHO highlighted the growing vaccine discrepancy between the low and high-income countries. 8 in 10 healthcare workers in high-income countries have been vaccinated, but only fewer than 1 in 10 in Africa. So a senior WHO official warned that this could cause the pandemic to drag into next year, and it's imperative that vaccines are evenly distributed throughout health workers in low-income countries as well.
Okay, Yeon-seung, thank you so much for your report throughout the whole week. You did a great job, and I hope to talk to you again in the near future.
Thank you.